My name's Sohrab Gollogly. I'm an orthopedic surgeon in Monterey, California, and I specialize in surgery of the spine and the hip. I'm going to take the next couple of minutes to demystify a common medical condition called spinal stenosis and spondylolisthesis, which causes low back pain, bilateral leg pain, and numbness and tingling in the legs of patients, typically in their 40s, 50s, and 60s. This is a very common condition. It affects approximately 5 to 7% of the population, and in the vast majority of cases it can be handled very easily with non-operative means. I'm going to take you through a series of x-rays, some MRI scan findings, and show you a few pictures from our clinic in which I discuss the non-operative and operative care of spondylolisthesis. In this first picture, we are looking at the AP x-ray of someone with a spondylolisthesis. This x-ray basically demonstrates that the spine is perfectly aligned in the frontal plane and the patient does not have scoliosis. However, when the patient turns to their side and we look at the lateral plane, we notice that at the L4-5 level there is a step-off and the L4 vertebral body has slipped forward with respect to L5. This is because degenerative disc disease, which affects everybody and is just as certain as death and taxes, has developed at the L4-5 level. The disc has become incompetent with age, and there's been a slight slip between the functional junction between the thorax and the abdomen and the pelvis. This is an MRI scan that demonstrates that as this slip occurs, a broad-based disc bulge develops at the L4-5 level, and this narrows the space available for the spinal cord and the nerve roots as it traverses past this area of spondylolisthesis. On the axial image of the MRI scan, which is a slice through the abdomen and the lumbar spine, we notice that there is concentric narrowing around the spinal cord and the nerve roots, and the space available for the spinal cord and nerve roots has diminished significantly. Contrast the limited amount of space available for the spinal cord and nerve roots on this axial image, which is taken at the L4-5 level, with the amount of space available here, just a centimeter above at the L3-4 level. And here at this level we can see that the individual nerve roots, which appear as tiny little dots as if we cut off a telephone cable with a pair of cable cutters, that are traveling down to the legs, have a great deal more space available to them in the spinal canal. The first thing to note is that the vast majority of patients can be treated for spondylolisthesis with physical therapy. We work very closely with a physical therapist in our clinic, and most of our physical therapy concentrates on trunk and abdominal conditioning exercises. These often use simple pieces of equipment that can be purchased for use at home, such as the Swiss ball that is shown in this picture here, and we emphasize strengthening the muscles of the abdomen and low back so that the spine is more stable and the patient's symptoms from spondylolisthesis decrease. If the spondylolisthesis is severe enough, then oftentimes physical therapy in and of itself may not be sufficient. If that occurs, then typically we have our partner, Dr. Gary Chang, who is a wizard at selective nerve root blocks, block the L5 nerve root bilaterally with a selective nerve root block that's done at our surgery center, a procedure that's done under local sedation. Oftentimes this is the beginning of a multidisciplinary approach to the surgical treatment of spondylolisthesis, but in the vast majority of cases, Gary is able to decrease the patient's pain to the point where surgery becomes unnecessary, or at least is delayed for 4 to 5 years. In instances in which people have such severe pain, bilateral leg pain, weakness, and numbness, that they wish to proceed with surgery right away, my partner Dr. Dragan Dimitrov, who's a neurosurgeon, and I perform this surgery at Community Hospital of the Monterey Peninsula. We're fortunate enough to work at a hospital where we have access to all the latest technology for advanced spinal surgery, and this is a picture taken in our operating room of the two of us performing spinal surgery. Here we see the results from a typical case of spondylolisthesis treated operatively. This is the same x-rays we saw at the beginning of this lecture, seen from the frontal plane, where we see 2 screws above and 2 screws below connected by titanium fusion rods. And here on the lateral x-ray we see that this has resulted in an improvement of the alignment between the L4 and the L5 vertebral body, and that as part of this process there has been a decompression at the L4-5 level as well, so that the nerve roots that pass by this level have much more space available to them. In our experience, most patients with spondylolisthesis that is symptomatic enough to warrant surgical intervention experience a very high improvement in quality of life after this surgery, and we are reliably able to relieve them of their back and leg pain.